So medication classification is a part of pharmacology. First one, antacid. Antacid reduce the hydrochloric acid in stomach, and also antacid stop the stomach ache because they neutralize the acid in stomach. The most common antacid we use, it is called calcium carbonate. And also the different form of antacid we use, some are aluminum based and some of them are aluminum magnesium based. The common side effect of all antacid, they can cause constipation. For NCLEX board, you should know antacid, especially calcium carbonate, it is good to give 1 hour after meal, means after food, with full glass of water. Easy way to remember, antacid start by alphabet A, and after meal, after started by alphabet A, or it is the similarity A and A are. So antacid can reduce the effect of antibiotics due to blocking the absorption of medication. Antacid also can cause hyperkalemia. Sometimes NCLEX board asks some question I want to share with you. Antacid or proton pump inhibitor like lansoprazole, pantoprazole, omeprazole, or H2 receptor blocker, right, like cimetidine, ranitidine, may reduce the effect of antibiotics. So antibiotics and antacid or H2 blocker or proton pump inhibitor separate dose by 6 hours after or 2 hours before antibiotics administration is good. The second medication here we're going to talk antianemics. So the medication we use for anemia, we call anti-anemic drugs. These groups of drugs increase the blood cell production. The most common anti-anemic drugs are folic acid, ferrous sulfate, and iron preparation. Folic acid, especially when pregnant mother, it is good to give them folic acid because folic acid can prevent the deficiency of neural tube defect. Deficiency of folic acid can cause neural tube defect. Spina bifida, we call. Iron preparation also can prevent or treat the anemias. Here I want to recap it. It is the NCLEX note. When you give iron preparation or anti-anemic medication, avoid use with antacid or coffee, tea, dairy product or eggs within 1 hour after iron preparation. Also, it is important to know, so if you give the iron orally, use a straw. Why? We use the straw to prevent the staining to the teeth. And vitamin C with iron increased vitamin C helps absorption of iron. Another question sometime NCLEX board asks about iron preparation. Intramuscular injection should be given using Z-tag method. Important for NCLEX board exam. Now let me talk about anti-emetics. Means the medication we use to stop the nausea and vomiting. Anti-emetics. The most common medication we use, it is called ondansetron, also promethazine. When you give this medication, we could educate our patient or tell your patient or give 30 minutes before the chemotherapy or 1 hour before radiation therapy. If you ask me why I'm talking about the chemotherapy or radiotherapy, after the chemotherapy for cancer patient or radiotherapy for cancer patient, they have a chance to develop nausea and vomiting. That times we give them anti-emetics like promethazine or ondansetron. Ondansetron may causes the headache. We should inform our patient. And promethazine, particularly the psychiatric medication, but we can use this psychiatric medication promethazine as an antiemetics that can be used for nausea. But it is important, every student must know, promethazine may cause the false positive pregnancy test in case of female. What next? Next, now let me explain about the anticholinergics. Anticholinergics decrease the oral secretion, right? Anticholinergics used to block the release of the anticholinergics inhibit the parasympathetic nerve impulses by blocking the action of acetylcholine. So the mechanism of action of anticholinergics, they blocking the action of acetylcholine. What is acetylcholine? It is neurotransmitter. They transmit the signal one neuron to other neuron. Most common anticholinergics we use atropine and ipratropium bromide. Atropine anticholinergics, they can block the action of acetylcholine. The NCLEX board asks a question about the atropine or ipratropium bromide. Let me explain. The antacid can cause dry mouth or blur of vision, can cause photophobia or tachycardia. So this medication can cause dry mouth. So it is good, educate your patient. Ipratropium bromide or atropine or anticholinergics can cause mucous membrane to become dry. So take this medication with full glass of water. Atropine, if your patient have a liver problem, it is good to avoid atropine with hepatitis. It is good to avoid atropine if your patient has a glaucoma or gastrointestinal obstruction. Because atropine decrease the liver function, atropine decrease the kidney function, right? Also, it is very important we could know that ipratropium bromide has some common side effect. Example, if your patient has a narrow angle glaucoma, and still if you give them ipratropium bromide, worsening of narrow angle glaucoma they can cause. Ipratropium bromide can cause mydriasis, means dilatation of the pupil. They can cause hypotension or palpitation, urinary retention, tachycardia, or bronchospasm. So, NCLEX note, if your patient need to take atropine or ipratropium bromide or anticholinergic, educate your patient to avoid this group of drugs with alcohol, ETHOS, ethyl alcohol. Also, use some precursor when they're driving or operating heavy machineries or perform other dangerous activities like driving car, deal with any machine where they need the alertness. It is good to avoid. Next group of drug here, it is anticoagulant. Anticoagulant we use to prevent the clot formation, right? Or you can say anticoagulant prevent blood clotting. Anticoagulant most commonly we use heparin or enoxaparin, or we use coumadin or warfarin, right? Heparin, particularly heparin, prevent the conversion of prothrombin to thrombin and prevent blood clotting formation. So if your patient need to take anticoagulant, it is very important routine monitor of PT. PT stand for Prothrombin time, or INR, International Normalized Ratio. Tell your patient to avoid over-the-counter medication and herbal product. Most of the herbal product and anticoagulant causes the interaction. Particularly, if your patient take heparin, we could monitor the PTT and INR. PTT means prothrombin time. If your patient take Coumadin, we could monitor PT and INR. PT means prothrombin time, and PTT means partial thromboplastin time, right? So what we could educate our patient, or what are the nursing implication? Teach patient to monitor for the sign of bleeding. So if they can see any sign of bleeding, it is good to inform healthcare provider. Especially for Coumadin, it is good educate your patient to limit the cabbage and green leafy vegetables. Limit, do not need to stop. Also, it is good to avoid caffeine and ethyl alcohol when your patient take heparin or enoxaparin or warfarin. Anticoagulant has a common side effect. They can cause bleeding. So when we see any sign of bleeding, means it is the side effect of medication. Anticoagulants sometimes cause thrombocytopenia, means platelet number go down, and also they can cause hemorrhage. What next? Next is anticonvulsant. The most common anticonvulsant we use, it is benzodiazepine. So anticonvulsant we use for management of seizure and bipolar disorder, right? Let me recap it. I said anticoagulant we use management of seizure or anxiety disorder or bipolar disorder. Most common anticoagulant are benzodiazepine. Other drugs we use as an anticoagulant are clonazepam, diazepam, lorazepam, florazepam, or phenytoin, and carbamazepine. The clozapine or diazepam, lorazepam has a common side effect. They can cause, here I wrote it, the side effect is easier to remember: A, B, C, D, and E, right? A stands for alter the vital sign. They can cause bradycardia, they can cause hypotension. So vital sign will be altered. B stands for blurry of vision, B stands for bradycardia, and C stands for confusion, constipation. So if your patient take benzodiazepam for a long time, patient chance to develop dependency. So it is good to give for short time, and also can cause constipation for a long time. And D stand for they can cause drowsiness, they can cause dizziness, they can cause central nervous system depression, or they can cause distension of bladder, we call retention of urine. Also, some patients complain of the lethargy, right? And other medication we use as an anticoagulant or anti-seizure medication, it is phenytoin. Other name of phenytoin we call dilantin. Keep in mind, if your patient take the antacid, it is good. Antacid and phenytoin or dilantin not give together, right? NCLEX board asks a common question, the side effect of phenytoin. That is called gingival hyperplasia, or it's called hypoglycemia in diabetic patient, or discoloration of urine. It is the common side effect of phenytoin. Phenytoin has a narrow therapeutic index, so we observe the overdose of phenytoin. If patient have overdose of phenytoin, we can see the twitching eye movement, loss of balance, or patient tremor, fainting, or feeling the light headache, slow and shallow breathing, muscle stiffness, or weakness. It is the common sign of phenytoin overdose. Let me talk about the carbamazepine. Carbamazepine also a narrow therapeutic index. We must check the blood level. Carbamazepine common side effect, most important side effect, they can cause aplastic anemia. A stand for absence, A stand for aplastic anemia. Means cell production go down, less WBC, less RBC, and less platelet, aplasia developed. We call it aplastic anemia. The carbamazepine side effect, they can cause dizziness, drowsiness, and dry mouth. So if you remember, side effect of carbamazepine is D. D stands for dizziness, drowsiness, dry mouth. But the major side effect, they can cause aplastic anemia. It is good you educate your patient. If your patient need to take carbamazepine, not to take the grapes fruit juice. Let me recap it about the anticonvulsant. What is the nursing implication? So if our patient have a liver problem, it is good avoid with liver disease and diabetic. Anticoagulant. Avoid alcohol with anticonvulsant. So it is good, do not chewing or crush out the anticoagulant tablet, anticonvulsant tablet. So anticonvulsant, when you give, avoid the taking antacid at the same time with, especially with phenytoin. Antacid inhibit the absorption of carbamazepine. And carbamazepine particularly take with food. and avoid the grapes fruits. And also, it is good to check the liver function test. Anticonvulsant drugs should not be stopped suddenly. If your patient needs to take anticonvulsant, it is good to wear a medic alert bracelet. What next? Anti-Diarrheal. So these groups of drugs decrease the gastric motility and reduce the water in the bowel. So anti-diarrheal, most common medication we use loperamide, right? But keep in mind, when you give loperamide, we could watch for constipation. This may also can cause rebound constipation. We give medication to stop diarrhea, they can chance to develop constipation. When you give loperamide, be precursor, be concerned if giving to the client with Clostridium deficit or infectious diarrhea. We have to observe. Loperamide, it is good to take 30 minutes before a meal. So, like your patient going to take the lunch or dinner, it is good give them 30 minutes before lunch or 30 minutes before dinner. The next groups of drugs here, it is antihistamine. Antihistamine blocks the release of histamine. And antihistamine used to block the release of histamine in allergic reaction. The most common drugs antihistamine we use, we call diphenhydramine. You can buy from Walmart, it is Benadryl. Or other drugs, loratadine, cetirizine, we call Z-Tac. The common side effect of antihistamine, they can cause dry mouth, dry nose, dry throat, or they can cause drowsiness, dizziness, fatigue, or sedation or sleepiness, dizzy or sleepy. They also can cause nausea and vomiting. Keep in mind, when we prescribed antihistamine, particularly Benadryl or diphenhydramine, you could tell your patient use including taking the food or milk, because food or milk to decrease gastrointestinal upset. So it is good to take with food. Diphenhydramine or Benadryl, this is an antihistamine that can also be used as a sedative. Sometimes some people complain they have a nausea because of traveling. So some travel nurse take it to sleep on during their traveling time. But allergic reaction, we use this medication, but we need doctor prescription. Sometimes doctor will prescribe this medication to the patient if they need to take a medication to which they are allergic. For example, blood or IV contrast before a CAT scan. If a patient is having a severe allergic reaction, it is good to give them diphenhydramine, or if diphenhydramine is not enough, good to give epinephrine. Diphenhydramine can also be given to reduce the nausea, to reduce the vomiting in cancer patient. What else? Other antihistamine is loratadine. Loratadine we can buy over the counter. We use for antihistamine, common cold, or rhinitis. Loratadine will cause dry mouth and tachycardia. It is good to take on empty stomach because food blocks the absorption. It is opposite diphenhydramine. And loratadine will cause drowsiness. And if your patient need to take loratadine, tell them to avoid alcohol. Also keep in mind, loratadine do not give to pregnant mother or nursing women who is doing the breastfeed, good not to give. The cetirizine or fexofenadine, most common antihistamine. We use as an antihistamine, we use for common cold or rhinitis. The cetirizine or fexofenadine also can cause dry mouth or tachycardia like loratadine. It is good take on empty stomach because food blocks the absorption of cetirizine or fexofenadine. Also will cause drowsiness, and avoid alcohol with cetirizine or fexofenadine. Other groups of drugs, it is called anti-hypertension. Everybody know, right? Anti-hypertension, there are a long group of drugs we use. Anti-hypertensive means they lower the blood pressure and increase the blood flow. The antihypertensive medication here, the antihypertensive medication we use like angiotensin converting enzyme or diuretics, or we use calcium channel blocker, beta blocker, vasodilator, or alpha agonist, alpha 2 receptor blocker. All of them are antihypertensive medication. Let me explain one by one. ACE inhibitor or angiotensin converting enzyme inhibitor. Antihypertensive lower the blood pressure but increase the blood flow to the heart. We use this medication treat hypertension and heart failure. Also, they protect the kidney function in the patient with diabetes mellitus. I'm talking about the anti-ACE inhibitor. The most common medication we use is a angiotensin converting enzyme inhibitor like enalapril, lisinopril, ramipril, captopril, or fosinopril, right? The end of this group are pril, P-R-I-L. So when you prescribe this medication, we could tell your patient or what are the nursing education or nursing implementation. SC inhibitor can cause the liver function problem or kidney function problem. So it is good to monitor the blood pressure, or it is good to check BUN level or creatinine level, means kidney function. Also, electrolyte level we need to check. SC inhibitor are contraindicated in pregnancy, right? SC inhibitor have some common side effect. For all of them, they can cause common side effect, I said. They can cause the cough, or they can cause the ankle edema, or they can cause the palpitation, orthostatic hypotension, potassium level go up, means hyperkalemia, or they can cause renal impairment. So we need to monitor the blood creatinine level. Sometimes angiotensin converting enzyme can cause impotency. Or severe cases, they can cause angioedema or Stevens-Johnson syndrome. Other groups of drugs here we use, it is called diuretics. Diuretics are basically excrete or expel out sodium and fluid from the body. The diuretics, loop diuretics, or we call potassium depleting diuretics, or thiazide diuretics. Thiazide or loop diuretics both are potassium depleting. Other diuretics are potassium sparing diuretics. We call the spironolactone. So loop diuretics, the common example are bumetanide or Lasix or furosemide, torsemide. And thiazide diuretics are hydrochlorothiazide or chlorothiazide. Loop diuretics or thiazide diuretics both can reduce the blood pressure or reduce the potassium level or reduce the sodium level, but they increase blood sugar level, they increase the BUN, blood urea nitrogen. Let me recap it. Loop diuretics or thiazide diuretics both are potassium depleting. Both can cause hypotension, hypokalemia, hyponatremia. They can cause tinnitus or photosensitivity. They reduce the sodium, reduce the potassium, reduce the blood pressure, but they increase blood sugar level. Means they can cause hyperglycemia. They can cause hyperlipidemia. They can cause hyperuremia. They increase blood urea nitrogen. So we could monitor blood urea nitrogen. We could monitor potassium level, glucose level. Also, we could monitor intake and output. We should teach your patient to increase potassium in diet. If your patient took furosemide or Lasix, if your patient take hydrochlorothiazide. What else? Other diuretics we use, it is called potassium sparing diuretics. Example, spironolactone or triamiterone, or we call water pill. Potassium sparing diuretics can cause hyperkalemia. It is opposite of loop diuretics and thiazide diuretics. Loop diuretics and thiazide diuretics can cause hypokalemia, potassium level go down, but spironolactone or triamiterone, potassium sparing, they increase potassium level, hyperkalemia. They can cause constipation, menstrual irregularities, and muscle cramping. So what is the patient education? We tell the patient monitor the electrolyte because potassium sparing diuretics decrease the potassium in diet. They also reduce the plasma volume but increase hematocrit. Other hypertensive are beta blockers. Beta blocker or beta adrenergic blocker. Beta blocker are used for management of hypertension, management of angina pectoris, or congestive heart failure. Also, beta blocker used for myocardial infarction prevention. The most common beta blocker are atenolol, propanolol, metoprolol, and carvedilol. So if your patient need to take beta blocker, what we could tell? We supposed to tell them, and let me explain easy way how we could remember if our patient take beta blocker. So in this box, we can see the beta blocker here. Particularly now I'm going to focus the beta blocker. Beta blocker, we educate your patient, check the pulse before admin the beta blocker. Also monitor the blood glucose in diabetic patient, admin with food, and taper the dose during discontinue. There are some contraindication of beta blocker. Easy way to remember: E, B, C, D. and E. A stands for asthma. If your patient have asthma, don't give beta blocker. B stands for heart block. If your patient have a heart block, don't give beta blocker. C stands for CCF, congestive cardiac failure. If your patient have a congestive cardiac failure, don't give beta blocker. D stands for diabetes mellitus. If your patient have a diabetes mellitus, don't give them beta blocker. And E stands for extremities or occlusive arteries. Don't give them beta blocker. Beta blocker has a common side effect. They can cause hypotension or bradycardia. They can cause dizziness. They can cause impotency. They can cause hyperglycemia. So if your patient have a diabetic, if you still give them beta blocker, they has to adjust the insulin doses. Beta blocker can cause bronchospasm, right? And let me tell something about the calcium channel blocker. The calcium channel blocker we use to treat the angina or hypertension. The common calcium channel blocker we use verapamil, nifedipine, diltiazem, or amlodipine, right? So if we need to give calcium channel blocker, what we could educate our patient. So tell your patient if they develop ankle edema, they should notify healthcare provider. The common side effect of calcium channel blocker, they can cause hypotension, headache, or peripheral edema, GI upset, or flushing, means cutaneous blood supply increase in the face, vasodilator, or syncope because of vasodilatation. So if your patient need to take calcium channel blocker, tell them to avoid operating machineries or avoid the grapefruit juice. What next? Next here, another antihypertensive, it is called vasodilator. Vasodilator. The vasodilator relaxes the smooth muscle in blood vessel. What are the drugs we use as a vasodilator? We use GTN, means glycine trinitrate or nitroprusside, nitroglycerin, isosorbide mononitrate or isosorbide dinitrate. So keep in mind, the all vasodilator has a common side effect. They can cause palpitation or tachycardia. They can cause hypotension, dizziness, headache, syncope, and weakness. So if your patient need to take, we could educate them. Particularly if our patient take hydrazine, it is good to take with food. Or if your patient need to take nitroprusside, it is good to tell them protect from light. And also continue EKG or blood pressure monitoring is important. And nitroglycerin always give sublingually and do not swallow it. What else? Other antihypertensive we call alpha agonist. Alpha agonist we use to decrease the effect of dopamine on blood pressure. The most common alpha agonists are clonidine and methyl dopa. The common side effect of alpha agonist or clonidine or methyl dopa, they can cause postural hypotension. So when patients change their posture, tell them to slowly. If they lie down, better to sitting, and from sitting, better to tell them to get up. Alpha agonist also can cause impotency, drowsiness, and dry mouth. Another medication, alpha-2 receptor blocker, we use valsartan or losartan. Losartan or valsartan can cause hypotension, can cause hyperkalemia, and angioedema. Some people or patient complain cough or renal dysfunction. So if our patient need to take, what are intervention we could do? What we educate them? Educate them here, particularly alpha-2 receptor blocker means here monitor the BUN or creatinine and electrolyte, right? And most of the times, valsartan or losartan we took orally. And other groups of drugs we use, it is called alpha-1 receptor blocker. It is called alpha-1 receptor blocker. Basically, in this group, receptor blocker, in this group, like prazosin, terazosin, or temlosin in this group. What we educate them about alpha-1 receptor blocker, tell your patient, administer dose at the bedtime. And also we could monitor blood pressure. Also monitor the access for edema. Also educate to avoid operating machineries. Alpha-1 receptor blocker medication has a common side effect, like they can cause hypotension, palpitation, blurred of vision, nausea, diarrhea, dizziness, and dry mouth. Anti-infective, right? So anti-infectives used for treatment of infection. The most common anti-infectives means antibiotics. The category of antibiotics are penicillin, example is amoxicillin or ampicillin, or penicillin itself. Second group here, cephalosporin. Cephalosporin are example cephalexin, ceftriaxone, cefazodine, or ceftazidime. Another group is aminoglycoside, like tobramycin, amikacin, neomycin, or gentamicin. Then tetracycline. The drugs we use, tetracycline itself or doxycycline. Fluoroquinolone, also antibiotics. In this group, ciprofloxacin, moxifloxacin, levofloxacin, or ofloxacin, most common. Other antibacterial we use like metronidazole, we call Frazil, or macrobid like nitrofurantoin, or we use the macrolide. Macrolide include azithromycin, clarithromycin, erythromycin, or clindamycin. The first group here, penicillin, we use for gonorrhea, for pneumonia, or urinary tract infection. So if your patient need to take penicillin, first ask about the history of allergy. Ask about any kind of reaction such as itching, rash, or hives. Do not give if any reaction has occurred in the past. Means if patient have an allergic to penicillin, good not to give. But penicillin is safe for pregnancy. Amoxicillin or ampicillin are safe for pregnancy. So if a patient first time take penicillin, the first time a patient take penicillin, stay with them just like blood transfusion. So if patient develop allergic reaction because of penicillin, the antidote we use, it is called epinephrine. So what we educate our patient about penicillin? Educate patient to take medication for full prescribed length of time and do not stop when symptoms disappear. The next group we wrote here, aminoglycoside. Aminoglycoside most strong member is vancomycin, streptomycin, azithromycin, or gentamicin. It is very powerful antibiotics to treat the condition like, meningitis, infective endocarditis, septicemia, or Clostridium deficit infection. The aminoglycoside causes ER toxicity. It is called ototoxicity or kidney toxicity. It is called nephrotoxicity. So they can cause kidney damage. So if your patient has a ear problem, effect on hearing, patient complain ringing and dizziness, ringing inside the ear. Keep in mind, aminoglycoside do not give during the pregnancy. If any patient have a aminoglycoside overdose, we give them antidote. It is called calcium gluconate. The third groups of drugs we wrote here, cephalosporin, right? Cephalosporin, basically example is cefazolin or ceftriaxone. Cephalosporin are the gram, they are very strong, again, gram-negative bacteria. We use cephalosporin for UTI, urinary tract infection, or pneumonia, gonorrhea, but do not give if your patient has a history of allergy to penicillin. Do not give cephalosporin. The common side effect of cephalosporin, they can cause hyperglycemia. So if your patient have a diabetic, if you give them cephalosporin, they have to adjust insulin. Cephalosporin sometimes cause anaphylactic shock if allergic reaction occur, or insufficient platelet. They can cause thrombocytopenia. Platelet go down, patient turns to bleeding tendency, renal impairment, nephrotoxic, or they can cause sometimes diarrhea. So if patient develop overdose for cephalosporin, we give them antidote epinephrine. Epinephrine antidote for penicillin as well as cephalosporin. Calcium gluconate are antidote for aminoglycoside. Next group of drugs here, tetracycline. I said doxycycline or minocycline or tetracycline itself. Tetracycline basically we use for urinary tract infection, pneumonia, gonorrhea, syphilis, or note here, if your patient have allergy to penicillin, we give them tetracycline. If your patient have an allergy to cephalosporin, we can give that tetracycline. Tetracycline can cause photosensitivity, phototoxicity, nephrotoxicity, and hepatotoxicity. Let me recap it. Tetracycline can cause kidney damage, can cause liver damage. Right? So if your patient take tetracycline, keep out of direct sunlight. Monitor the liver enzyme and monitor the kidney function, right? Also, we could monitor the urine output. So it is good, do not give tetracycline if the pregnant or nursing mother, like aminoglycoside, do not give to the pregnant mother. And tetracycline, do not give with cow milk, do not give to the children under 8 years old because will cause the teeth to turn black. And give the medication with a straw. Also good to avoid giving with Lasix. And next group here, is fluoroquinolone. Fluoroquinolone, most important group, ciprofloxacin. Keep in mind, ciprofloxacin or fluoroquinolone or ofloxacin, they have a chance to cause common side effect, tendonitis or tendon rupture, nausea, vomiting, diarrhea, or rash. They also can photosensitivity. Keep in mind, ciprofloxacin increase the effect if we give other medication like theophylline, coumadin, dilantin, or with steroid and diuretics. On the other hand, if you give ciprofloxacin with the groups of drugs like antacid or multivitamin or iron, decrease the effect. Another groups of drugs we wrote here, it is macrolide. Macrolide like azithromycin, clarithromycin, or erythromycin. So the common side effect of these groups of drugs, they can cause nausea, vomiting, and diarrhea. They can cause thrombocytopenia, means platelet number go down. Sometimes patient complain abdominal pain or they have a taste change, causes super infection. Some unlucky patient develop Steven Johnson syndrome because of azithromycin, clarithromycin, erythromycin, or clindamycin. What else? Next group of drugs here, bronchodilator. Bronchodilator we use as a respiratory medication, right? So these groups of drugs can cause dilatation of our lungs alveoli. We call respiratory medication. As a bronchodilator, we use theophylline or L-Butyrol, montelukast, or fluticasone. Let me tell about the theophylline. Sometimes we use aminophylline as well. Theophylline or aminophylline are bronchodilator. They dilate the lung alveoli. These groups of respiratory medication will cause tachycardia. So if your patient need to take theophylline or aminophylline, it is important to monitor for toxicity because they have a narrow therapeutic index and normal level 10 to 20. So if medication concentration less than 10, they does not work. If it is more than 20 concentration in the blood, they are toxic. If our patient take theophylline or aminophylline, we could educate them to avoid caffeine in diet. Second bronchodilator we use, it is called L-Butyrol. L-Butyrol used for acute or severe asthma. As like as theophylline or aminophylline, L-Butyrol will cause tachycardia. They may cause the tremor. The third group here, montelukast. Montelukast is a bronchodilator, but we do not use bronchodilator for severe asthma attack. So if asthma is a chronic disease, if your patient has a acute asthma, we call acute exacerbation of chronic asthma, we never use montelukast in acute attack. In acute attack, we do not use the fluticasone propionate. Montelukast, this medication take a long time to work and give in the evening. Another group is called fluticasone. Fluticasone is a bronchodilator, but do not give for severe asthma attack, right? What we educate our patient about the bronchodilator? Always give bronchodilator, like example, a patient need to take bronchodilator and steroid together. Always give bronchodilator first before you give steroid. When during the breathing treatment. What next? Next here, diuretics. So diuretics decrease the water and sodium from loop of Henle, right? And diuretics excrete the sodium and fluid. We use loop diuretics and thiazide diuretics, right? And here the loop diuretics, most common medication we use furosemide or bumetanide. Other name of furosemide is called Lasix. Loop diuretics or thiazide diuretics, both are called potassium depleting, means they decrease the potassium level. Loop diuretics and thiazide diuretics both can reduce blood pressure, reduce potassium level, reduce sodium level, but they increase blood sugar level, increase BUN level. Loop and thiazide both can cause photosensitivities, right? Keep in mind, the loop diuretics most efficient and fast acting. The loop diuretics can be given orally or intravenous route. If your patient need to loop diuretics like Lasix or furosemide, watch for a decrease the potassium level. They may cause ototoxicity, particularly the chance will increase when give with aminoglycoside. Loop diuretics used for acute edema like pulmonary edema or chronic heart failure. Another one is called thiazide. most popular medication, we use hydrochlorothiazide. It is work in the distal tube. So thiazide act in the distal renal tubules and used for chronic hypertension. They are slow-acting diuretics or increase the toxicity in heart medication and decrease the effectiveness of antibiotics agents. So if your patient are diabetic, it is good to tell to adjust insulin doses. The other group is called potassium sparing diuretics. Example are spironolactone or triamcinolone. Potassium sparing diuretics used orally, not as powerful as loop diuretics. If our patient take potassium sparing like spironolactone, it is good to watch for an increase the potassium level. And their action is side effect is opposite the loop or thiazide diuretics. Loop and thiazide diuretics can cause reduced potassium level, but potassium sparing diuretics can cause increased potassium level. Do not give to the patient with diabetic mellitus. I'm talking about potassium sparing or spironolactone diuretics. And this group best diuretics for hyperaldosteronism, but may causes the agranulocytosis. Means WBC go down. When WBC go down, patient turns to catch up infection, and when patient come to you, they complain fever or other sign of infection. What next? Next here, laxatives. Laxatives promote the passage of stool, right? Now here, laxatives increase the bowel evacuation, and also we use for treatment of constipation. About the laxatives, some notes are important to know here, and what we educate our patient. If our patient need to take laxatives, we could monitor for electrolyte imbalance. Laxative, if patient take lactulose, may can use to decrease the ammonia and increase in ammonia level in the client with hepatic encephalopathy. So we could educate the patient if have rectal bleeding. They should inform the healthcare provider if they have a rectal bleeding, right? Now, let me explain two more medication here. And this one is Myotics and Mydratix. This is eye medication. Myotics, right? The spelling is MIO. They can cause constriction of the pupil. The spelling of constrict, C-O-N. So O, myotics, and constrict O, two alphabet O. Myotics is seen this picture. constrict the pupil. This is the small pupil here, the not bigger one, small in the center. Pupil is constricted. Myotics. Little word, little pupil. Mydratix. MYD. D stand for dilatation of the pupil. Mydratix. This is the dilated pupil. Big word in relation to the myotics. Mydratix, big pupil, right? Dilatation of the pupil. The key word we must know about this. Another medication is called narcotics or analgesia. The narcotics most commonly we use to relieve the moderate to severe pain. Narcotics most commonly use morphine, fentanyl, meperidine, or hydromorphine. Meperidine other name is called Demerol. So if our patient need to take narcotics, we need to know the common side effect about the narcotics. The risks of dependency, they can cause nausea, vomiting, and pinpoint pupil diaphoresis or central nervous system depression and dry mouth. The NSAID, non-steroidal anti-inflammatory medication we use for moderate to severe pain, most common drugs, ibuprofen, we can buy over the counter, is called Motrin, or indomethacin, naproxen, or celecoxib. NSAID sometimes can cause hypertension, diarrhea, dizziness, epigastric pain, or heartburn. Gastric or duodenal ulcer increase with bleeding. Another narcotics or analgesia are opioid. Opioid we use for moderate to severe pain, but they promote the sedativeness, sedation. It is agonist and analgesic. Example are tramadol. When we give opioid, they have a major side effect, respiratory depression, dizziness, nausea, and they can cause constipation. So what are the nursing education we could tell our patient? Nursing implementation. Narcotics, if your patient take narcotics, it is good to report the problem. If they have problem about urination, such as the pain, difficulty of urination, or frequency of urge to urinate, or if the decrease urine output, or sometimes patient develop constipation for long time use, or nightmare may be sign of overdose. If our patient have opioid overdose, we give them antidote and it is called naloxone. So avoid with other medication causing the central nervous system depression, like monoamine oxide inhibitor or antihistamine or muscle relaxant, not to give with opioid. And NSAID, it is good to take with food, or tell your patient to monitor for sign of bleeding. Also, it is good to avoid use of aspirin and anticoagulant with NSAID, anti-inflammatory medication. Also, if your patient take narcotics or analgesic, it is good to avoid operating heavy machineries or driving. And there are some contraindication as well. So if your patient have a active gastric ulcer or duodenal ulcer, is good not to take non-steroidal anti-inflammatory medication. If your patient has a liver problem, it is good not to use narcotics or opioid. When time will come to stop this medication, especially opioid, taper the dose to discontinue.